Now, if there's been a stuff-up in Australia when it comes to managing this pandemic, it was, of course, the Ruby Princess. 2,700 people were allowed off the cruise ship in Sydney last Thursday. This was an outrageous mistake because some were already sick. Thanks to that, there's been the one death we've reported today. There's been 107 cases of COVID-19 added to New South Wales and another 26 cases spread around the rest of the country, and we'll have to wait to see how many more they've infected. The New South Wales government doesn't have any excuses.
It was a monumental stuff-up. I'm furious. The Premier's furious. The Health Minister has made some comments about it. But we just can't cry about it. We've got to, it's like any battle, we've got to take the hit and to get on with the job.
Now there are calls to block any more cruise ship arrivals in the country, certainly in New South Wales, but obviously people are going to have to come home. They'll just have to be properly isolated for the appropriate period. And just on that, there's some new research conducted on the cruise ship that was stuck in Japan in January. There were more than 700 people infected on the Diamond Princess, and 8 of those people died. This American report says the coronavirus survived for up to 17 days aboard the Diamond Princess cruise ship, living far longer on surfaces than previous research had shown. This was according to the Centre for Disease Control and Prevention. And if we go to the detail of that research paper, there's even more fascinating information. As mentioned, the virus survived on a variety of surfaces in cabins on both symptomatic and asymptomatic infected passengers up to 17 days after the cabins were vacated on the vessel and before they were disinfected. Now, it also found that almost half of those infected didn't know it. There was a high proportion, 46.5%, who were asymptomatic at the time of testing positive, and there were statistical models of the Diamond Princess outbreak that suggest 17.9% of infected persons never developed symptoms. Let's just break that down. Nearly half the people who tested positive didn't have symptoms at the time, and almost 1 in 5 of all people with the virus never got any symptoms. On top of that, the virus lives for 2.5 weeks on surfaces. You think about that. People who don't know they've got the disease, who might never know they've had it, leaving it behind for others 2.5 weeks later. Now, the reason I share this information is not to frighten people, quite the opposite. As we've seen in Australia, the death rate, in fact the rate of hospitalisation even, can be kept very, very low, and we hope that continues. But this research highlights the absolute importance of social distancing and hygiene. It highlights how those messages need to be heeded. People who never know they're sick might leave that virus on a handrail, on a button or on a cup where it can live for more than a fortnight. Wash your hands, keep your distance, slow the spread.